Okay, so what we're going to do is we're going to find ideal positioning, and we're doing it on the table, but typically you're going to do what we're going to do on the floor or against the wall. And the importance of this very basic thing is so, so important and has such powerful health effects. I cannot underemphasize the importance of it.
Okay.
So you're going to bend both the knees. So go ahead and bend and plant the feet. And you want about a 90-degree angle, which is what you got there. And then you want to line up so that the heels are kind of heels, knees, sit bones, as if you were standing in a position where you'd feel strong if you were standing and your feet would be underneath your hips. Mm-hmm. Then what you're going to do is you're going to tilt the pelvis backwards and forwards like that. And you're going to do that 3 times, and you're going to find what you feel is the middle position. Then hands at your sides. So more here. And really think about shoulders being nice and wide. And if I push up on your shoulder, don't push down, push down. So push your down like you want the shoulder to go this way. Good. And what you should feel is you should feel the muscles back here, your lats. Mm-hmm. And by engaging your shoulders, you actually stabilize the lumbar spine. And then back the neck, nice and long. So yeah, perfect. Okay. So that's the ideal positioning. Now the powerhouse is a combination of 3 things: breathing in a specific way, contracting a deep abdominal muscle called the transverse abdominis, and you kind of said that you did some of this already, and then contracting the muscles of the pelvic floor. So first the breath. It's going to be into the nose, out through the mouth, through pursed lips and tongue. So it's going to look and sound like this. Shh. Can you show me? Shh. Awesome. Okay, now abdominal muscles. We have 3 layers of abdominal muscles. We have the rectus abdominis, the abdominal obliques, and then one we're concerned with right now, the transverse abdominis, named because it goes transversely across the lower belly, and it draws the lower belly in towards the spine. If you take 2 fingers, your left hand right here, you feel the pointy hip bone right there, and you come just to the inside. I'm going to feel this side. So now what I want you to do is I want you to take that breath in, breathe out, draw the lower belly back. Keep pushing, push, 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 push more, push more, push more air, more air out. Keep going, push, every bit, keep going, push, push, push more. Okay, breath in again. And then again, try and draw the lower belly. That's a much better contraction now. Can you feel that contraction happen? Okay, now muscles of the pelvic floor. Ever heard of Kegel exercises? Yes. That's essentially what we're going to do. So pelvic floor muscles sit here. Urethra, what we pee out of, anus, what we poop out of, both pass through it. When you contract that muscle, it moves up towards your head and takes everything with it: penis, testicles, anus. Can you contract your pelvic floor muscles? Mm-hmm. 2 cues to help people get connected a little bit extra is that if we have somebody stop peeing in the middle of peeing, that's an engagement of the pelvic floor, but we don't want people to do that on a regular basis because that does promote urinary tract infections. And the other one is holding in a fart. So just extra oh yeah, I get it. So now go ahead and hand here again. So take that breath in, breathe out, engage, lift the pelvic floor. Okay, breath in again. And again, draw in, lift the pelvic floor.